So I'm Jonathan Serody. I'm the division chief of the Division of Hematology, and my specialty clinically is bone marrow transplantation and cellular therapy. So the patients I take care of are predominantly individuals with leukemia, myelodysplastic syndrome, some individuals with high-grade lymphomas, and then a smaller group of individuals with inherited bone marrow failure or acquired bone marrow failure problems. The bone marrow transplant and cell therapy program uniqueness is, I think, the camaraderie that we've developed, the relationships across different disciplines, and the team-focused approach that we take to patient care. We've, I think, had as good as any transplant program our size in the country in outcomes. I think we pride ourselves on that. We get metriced against other transplant centers, and we've been at the top of the state of North Carolina for multiple years, and I think that's a testament to the team that works together to try to do the best we can for patient care. My approach to care for what we do tends to be fairly lengthy, detailed, and hand-holding in a way. Most individuals don't have a really robust understanding of stem cell or bone marrow transplantation or cellular therapy. So we walk through that procedure for the first 60 to 120 minutes of the initial encounter, answer any questions that they have, and then develop a relationship with the patient so that over the next 4 to 8 weeks, we can get them to the point where they can decide whether or not this is a treatment that they want to undergo. The patients that I've taken care of over a long period of time that still come back and see us, so I've got individuals that I'll see in clinic that have been transplanted 1, sometimes 2 decades ago, and getting to see them. The younger people go on and get married and start their lives is really quite rewarding. And the older ones who get to retire and see grandkids and do what they want, that's also immensely rewarding. And then mentoring and training younger physicians, both at the fellowship level and then at the junior faculty level, to get to the point where they can kind of reach the levels that they want to reach. I enjoyed as a kid growing up through kind of teenage and early college years, music and playing music. I come from a pretty musical family, so all of us played instruments when I was a kid. And my dad was quite good and my brother was quite good as well, so we had a small little ensemble that would do that. And I still mostly now listen as opposed to playing music. And then I like outdoors a lot, so I have a 90-pound dog and we take pretty significant strolls through a fairly large wooded area behind my house. It's about 50 or 60 acres. You can see me on TV occasionally in the diagnosis unknown murder section on Lifetime Health, I think it was, or Discovery Health. I was part of a group that helped identify an individual who was using arsenic to kill her boyfriends and husbands, who is on death row in North Carolina. So they did a whole episode on that.